Um, and then please note that while this is a choices specific WebEx, we do hope that there is enough information in this presentation for everyone involved to gain a little bit more insight on the reportable event management process. Right. I think we can go on to the next slide. Awesome. So what you can expect to learn today is we'll provide a high-level review of the reportable event management purpose, the benefits of the alignment and the process, as well as how the system applies to you using choices specific scenarios, as well as answering our choices specific pre-submitted questions, and then provide some guidance as to next steps as we move along in this process. Okay. As you're already familiar through these WebEx discussions and the trainings that you've completed, as well as the various correspondence that you've received through DIDD, as well as through the MCOs and TennCare, the reportable event management is an important component for an overall approach to ensure the health, safety, individual freedom, and quality of life for those supported in home and community-based service settings. In partnership with our providers, TennCare and DIDD, we're able to work together to ensure the highest possible quality of life for those that we support. Remembering that reportable event management also aligns with dignity of choice, ensuring the person has the right to make an informed decision to engage in experiences of his or her own choosing, which, as we know, are necessary for personal growth and development. All right, so we'll move on to the benefits of reportable event management. So the reportable event management alignment process offers a streamlined, person-centered reporting process across all LTSS programs. It defines evidence collection to support the due process, strategies, it standardizes the definitions of reportable events. It sets clear roles and responsibilities of the staff. It supports the dignity of choice, as we previously mentioned. It promotes consistency of action, review, and investigation across all programs. And it also allows for cross program tracking and trending for quality improvement efforts. And we really wanted to ease some minds because we've had this question often of, why was the alignment developed? So we want to ensure that it's noted that the alignment process was not developed because providers were doing something incorrectly, but rather to better align all programs to provide a consistent standard for training, investigations, and to incorporate the due process piece. And to touch a little bit on the application of the reportable event management process, the reportable management process is a system, and all aspects of the system is a requirement for all providers who participate in the 1915C waiver programs, the ECF, so Employment and Community First Choices program, Choices, the Katie Beckett Waiver Program, and both public and private intermediate care facilities for persons with intellectual disabilities, so the ICF IDD programs. There are those providers who are exempt from pieces of the requirements, and those providers will be identified later in the presentation. You can also find a detailed list of providers exempt from specific areas of the process on the DIDD REM website. I know that's kind of been a question in times past, and so we really wanted to ensure that we touched on that as well in this presentation and noted that there are those resources to be able to clearly identify that list as well on the website. So choices providers, as well as the ones I previously stated above, are required to have a certified provider investigator trained to conduct Tier 2 investigations as part of the reportable event management process. As this is across the board. We've had this conversation in multiple WebExes. So all of our providers are required to have a certified provider investigator, or you can choose to have a business associate agreement, so a BAA, with another provider that has a certified provider investigator on staff to conduct investigations for your agency. If you not yet done so if you've not yet registered to have a provider investigator or provided the BAA information to DIDD, please do that. Please submit your information. If you need the information on how to complete the registration or provide this information to DIDD, check with your leadership, as they would have been the ones to receive the email correspondence either from DIDD and or the MCOs, depending on who you're contracted with. Also, the information is provided on the DIDD website as to how to submit your provider investigation information. So if you have any questions after checking in with your leadership or looking at the website, please do feel free to reach out to one of the three MCOs that you're contracted with. You may only be contracted with one of us, whichever one works best for you. If you have that information at the ready, feel free to reach out and we will help guide you through that process. So I think now the moment you've all been waiting for to stop having to listen to me and the stuff that you probably just some reminders. We'll move on to Leanne and Jamie presenting some of the choices specific scenarios as we continue on with the application piece of the process.
Hello, everybody. It's Leanne from Blue Care. I'm also part of our reportable event management team. Um, and I'm going to talk you through, we've got a total of 12 scenarios today, and each of those scenarios is going to be laid out in a similar fashion with background scenario, actions taken, and then go through and discuss the resolution and follow-up actions. We did try to go through and give examples of several different types of different tier types, different event types as we go through. This is in no means all inclusive, but we did try to just really go and hit those ones we think that would be most common and that you guys would experience most often. But again, it's not all inclusive because we do have some time requirements. We're going to try to stick through today. If you have questions on these, again, if you want to stick them in the chat, we'll get to as many as we can after. And if we don't get to them, we'll make sure to answer them and get them published back out. This information is going to be available to everyone after the entire presentation, as well as the FAQs will be published out on the DIDD REM website. And all right, go to the next one. Okay, our first scenario is going to be with Mr. Reese. This is going to be a tier 1 reportable event with unexpected unexplained death as the type or as the classification. So our background, Mr. Reese is a 75-year-old male enrolled in Choices. He's paraplegic and relies on a power chair to get around his home and in the community. He loves riding his chair around the neighborhood and visiting with friends. While Mr. Reese's agency worker was with him, they decided to go for an outing through the neighborhood. The two had lunch at a local park. After lunch, the agency worker went to wake Mr. Reese and he was unresponsive. So what happens next? The actions taken. The agency worker calls 911 and performs CPR. After calling 911, Mr. Reese's agency worker calls the provider agency event management coordinator, the EMC. And we have also had some questions on this, but as a note, CPR certification requirements are not changing with the REM system process. So whatever your CPR certification requirements are with your current provider, they're going to stay the same. Nothing changes with this. An ambulance arrives and takes Mr. Reese to the local emergency department where he is pronounced deceased. The EMC immediately calls the DID investigation hotline as soon as possible, but within 4 hours of witness or discovery of the occurrence to report the event and the death status of Mr. Reese. EMC also notifies Adult Protective Services, APS, within 24 hours for all abuse, neglect, and potential exploitation events. The EMC completes the REF, the reportable event form, and submits it to both DIDD and the MCO by close of the next business day after the occurrence or discovery. Okay. So some additional actions taken. Once that information gets to DIDD, DIDD will confirm that the event is a Tier 1 reportable event, unexpected, unexplained death. DIDD will conduct the investigation of the Tier 1 reportable event regarding Mr. Reese. The investigation report is completed after 45 days because DIDD investigator had to wait for the autopsy report to be completed. Just a note is the investigator has 30 days to complete that investigation unless there's a reason to request an extension, which happened in this case, at which time the DIDD investigator requests and has an additional 30 days to complete the investigation. Upon review of all available evidence, DIDD concludes that the event was not attributed to acts or omission by the agency worker. The investigation report is sent to both the MCO and the provider via secure email, and the event is unsubstantiated as evidence did not support any actions by the agency or the worker contributing to Mr. Reese's demise. So the event resolution and any follow-up actions, the MCO is going to review the reportable event form, the REF, the final investigation, any supporting documents, and the provider action plan if there is one, and determines that no additional quality of care issues exist. Okay. So that case would be, with Mr. Reese, would be closed at that point. Moving on to our next scenario, this is Mrs. Wolf. This is going to be a classification of a Tier 2 reportable event with alleged physical abuse. Our background is scenario. Ms. Wolf is a 32-year-old female. She's enrolled in Choices and lives in a community living support, CLS home with 2 other supported persons. A CLS worker found bruises on Ms. Wolf's arms on a Saturday evening. When Ms. Wolf was questioned about the bruising, she stated she was unaware of how it occurred. The worker reported the bruising to the administrator, and the bruises did not require medical treatment and/or intervention. So next, with our actions, the event management coordinator, the EMC, notifies APS within 24 hours for all abuse, neglect, potential exploitation events. The following Monday morning, because this did happen on Saturday, EMC completes the REF, submits it to DIDD and the MCO, which is close of the next business day after the occurrence or discovery. When obtaining information for the REF, the supported person alleges that another worker was mean to her, resulting in the bruises. However, she wouldn't really give any other details. Due to the allegation, the EMC removes the worker from the home and places him or her on administrative leave during the course of the investigation. Next, there we go. After additional triage of the REF, which includes interviews with the person supported, interviews with any other direct witnesses, reviews of the plans of care, DIDD does confirm that the event is a Tier 2 reportable event. Provider investigator conducts the investigation after being assigned by the DIDD investigation specialist. The provider investigator submits the draft investigative report to DIDD and the MCO within that 25 calendar day time frame. During the investigation, the worker admits that she did grab Ms. Wolf's arms during behavior, but did not intend to harm her. The worker was re-educated on reporting guidelines and appropriate interaction with persons supported. And by the 25th day of the investigation anchor date, the provider submits that draft provider investigation report to both DIDD and the MCO. Oh, I'm sorry. Can you go back a slide? I skipped a bullet. Sorry about that. Next, the last bullet here, the worker was re-educated on reporting guidelines, appropriate interaction with person supported. They received a disciplinary warning and they were removed from further working with Mrs. Wolf. And then by the 25th day, the provider submitted that report to both DIDD and the MCO. Now I'm ready. There we go. By the 28th day of the investigation anchor date, DIDD Regional Investigation Specialist, the IS, and the MCO reviewed the draft of the provider investigation report to determine if there was any other information or documentation needed. And at that point, if further information is needed, the regional IS will correspond with the provider. So you all will hear from that regional contact. The provider then has 1 to 2 calendar days to provide the requested information, or there can be an extension requested via the extension request process that's in the REM protocol. Upon extension approval, a provider can receive an additional 30 calendar days to provide the requested information or documentation. The number of days is based on the actions needed, and it's not automatically 30 days. It's really taken into consideration whatever information you need to provide and how long it's anticipated that that's going to take. So by close of business on the 30th day of the investigation anchor date, if there's no extension requested, the DIDD Regional IS will close the provider investigation report. Upon acceptance of the final investigative report, the provider is going to have an additional 10 calendar days to complete an action plan, which will be tracked by the date in which the final investigative report was closed. When that action plan is completed, that provider is going to simultaneously submit to both the DIDD and the MCO to review. The DIDD Regional Event Management Coordinator and the MCO are going to both review that action plan, which includes any concerns or issues identified from that initial review. And the DIDD Regional EMC will include the REM when asking the provider for any additional information within 10 calendar days. If the action plan submitted does not sufficiently address the identified concerns, the provider is going to have an additional 10 days to provide additional information. For both substantiated and unsubstantiated investigations, providers must ensure that informational findings are acted upon in a timely manner, with DIDD and or the MCO requesting follow-up action to unsubstantiated informational findings. And that it does include late reporting. That was a lot of words, so make sure to put any questions in the chat if you've got them. Event resolution and follow-up actions. MCO and DIDD reviews the provider's action plan, including the investigation and additional policy documents requested. The DIDD regional office submits a closure letter, which informs the provider that the actions taken or to be implemented were accepted, so everything is okay and good. As part of the action plan, training documentation is included that shows the worker completed additional training and signed an attestation that she understands Ms. Wolf's person-centered support plan, PCSP, and reporting guidelines. All right, hold on, I gotta get a sip of water. Excuse me. All right, moving on to Ms. Julian. This is going to be a reportable medical event with a choking episode requiring intervention. So Ms. Julian is a 65-year-old female. She's enrolled in Choices. While Ms. Julian's agency worker is in the home, Ms. Julian choked on a piece of chicken when she was eating. The agency worker was able to successfully dislodge the chicken using the Heimlich maneuver. So actions taken, the agency worker notifies the EMC of Ms. Julian's choking episode and of the intervention, which was the Heimlich. The agency worker notified the agency's EMC, or excuse me, moving on. The provider reviews Ms. Julian's PCSP to ensure the worker followed any specific actions regarding meal preparation. EMC completes the ref, citing this is a reportable medical event, which is choking episode requiring medical intervention, and submits to DIDD and the MCO by close of the next business day after the occurrence or discovery of the reportable event or intervention. So upon completion of review, it was determined the worker followed Ms. Julian's PCSP and the provider is going to continue to monitor. Okay. All right. Moving on to meeting Ms. Engel. This is a reportable behavioral event with self-injurious behavior. Ms. Engel is a 59-year-old female enrolled in Choices and living in a CLS home. Ms. Engel likes to stay engaged with her friends and family on social media via her cell phone. Ms. Engel became upset when she could not find her cell phone. She began to pace back and forth and state she was going to leave, she was going to her room. The CLS worker went to check on Ms. Engel in her room and found she's banged her head into the wall, causing a laceration to her head. Self-injurious behavior is not identified on Ms. Engel's PCSP. The agency worker calls 911. Ms. Engel was transported to the emergency room at her local hospital. She was evaluated and received 10 stitches. The CLS worker notifies the EMC to report the self-injurious behavior. The CLS EMC completed the ref, submits to DIDD and the MCO by close of the next business day after the occurrence or discovery. The agency outreaches to the member's care coordinator, who contacts the member's treating physician. The member's PCSP is updated to reflect self-injurious behavior. CLS Home is receptive to assistance offered and will work in collaboration with the MCO, primary treating physician, and the behavior analyst to implement a plan to decrease behaviors. All right. Mr. Stanley, this is a non-reportable event. Mr. Stanley is a 72-year-old male enrolled in Choices. He left his home at 3 p.m. during the provision of Choices services and returned at 3:59. Mr. Stanley's PCSP does not require 24/7 supervision. Since he was not away for 60 minutes or more, this is a non-reportable event. The Choices provider will document and conduct a trend analysis to develop future actions if warranted, but again, this is a non-reportable event. Right, taking us along to meeting Mrs. Brooks. Ms. Brooks, this is a Tier 1 reportable event with alleged exploitation exceeding $1,000. Ms. Brooks is a 68-year-old female enrolled in Choices Services. Ms. Brooks reported to the provider that her Choices worker took her debit card and spent $1,200 at a local department store. She reported the alleged event to the police. The Choices provider reports the event to the EMC. EMC immediately calls the DIDD investigation hotline as soon as possible, but no later than 4 hours after the occurrence of the event or the discovery thereof. The EMC notifies APS within 24 hours. The EMC completes the ref and submits it to both DIDD and the MCO by close of the next business day. DIDD confirms the event is a Tier 1 reportable event with alleged exploitation exceeding $1,000. DIDD conducts the investigation of the Tier 1 reportable event regarding Ms. Brooks, and the investigation is completed within the 30-day time frame. Okay. Upon review of all available evidence, DIDD substantiated the allegations of exploitation. The investigation report is sent to the MCO and the provider via secure email. Upon acceptance of the final investigative report, the provider will have an additional 10 calendar days to complete the action plan, which is tracked by the date in which the final investigative report was closed. The provider is going to send both the action plan to both DIDD and the MCO for review. Again, the same steps as before. The DIDD Regional Event Management Coordinator and the MCO are going to review that action plan, which includes any concerns or issues identified from that initial review. EMC is going to include when asking the provider for any additional information within 10 calendar days. If the action plan submitted does not sufficiently address the identified concerns, and then the provider has that 10 calendar days to provide additional information. Again, for both substantiated and unsubstantiated investigations, those informational findings do need to be acted upon in a timely manner, and DIDD and or the MCO can request follow-up on those as well. The MCO reviews the action plan, including the investigation, and determines that no additional quality of care issues exist and responds accordingly. MCO and DIDD reviewed the action plan, including the investigation and additional policy documents. DIDD Regional Office submits that closure letter, which informs the provider that the actions taken or to be implemented were accepted. The choices provider terminated the worker, and Ms. Brooks is happy with the new worker in her home. All right, so that's it for me. I'm going to hand it over to Jamie. Thank you, guys.
Thanks, Leanne. Hi, everyone. I'm going to be talking about Ms. Roberts. Um, the classification for this one is a reportable medical event and intervention, pneumonia, including an emergency room visit. Ms. Roberts is a 76-year-old female receiving choices services 2 days a week on Tuesdays and Thursdays. Upon her arrival for her shift on Tuesday, Ms. Roberts tells the agency worker she went to the emergency room on the previous Friday because she was short of breath. Ms. Roberts was diagnosed with pneumonia. She received intravenous antibiotics in the emergency room and was discharged home. The actions taken, the agency worker completed the REF, indicating reportable medical event, pneumonia, ER visit, and informs her supervisor. The agency's event management coordinator forwards the REF to DIDD and the MCO by the close of the next business day after the occurrence or discovery. The event resolution and follow-up actions, the agency will perform data collection and analysis for tracking and trending. Okay, the next scenario is Mr. Gregg. This is another reportable event and intervention, falls with injuries, 911, ER, emergency management services, X-ray, and hospital admission. Mr. Gregg is an 85-year-old man receiving choices services. While the agency worker is assisting him to the toilet, Mr. Gregg trips and strikes the bathroom vanity hard with his hip. The agency worker is unable to assist Mr. Gregg with standing due to extreme pain in Mr. Gregg's right leg and hip. So the actions taken, the agency worker calls 911. Mr. Gregg is transported by ambulance to the local hospital where he undergoes evaluation and surgery to repair a broken hip. The agency worker notifies the EMC or event management coordinator and completes the reportable event form indicating this is another reportable event, falls with injury, call to 911, ER visit, EMT, X-ray, medical hospital admission, and forwards to DIDD and MCO by the close of the next business day after the occurrence or discovery. Just a note there, so when the REF has been completed, every applicable concern or issue is documented on that REF. So the event resolution and follow-up actions, the agency will perform data collection and analysis for tracking and trending. Okay, next, we're going to talk about Ms. Hatfield, and this is a non-reportable event. Ms. Hatfield is a 75-year-old female who receives choices services 2 times per week. During the provision of services, Ms. Hatfield is making coffee and hits her head on the cabinet. There's a small bump and bruise. Ms. Hatfield complains of a headache and dizziness. So the actions here, after discussion with her supervisor, the agency worker calls the member's daughter, who transports the supported person to the ER for evaluation. At the ER, Ms. Hatfield is evaluated but deemed to be fine with no serious injury. No treatment is required in the ER. This event is non-reportable due to not having treatment, no treatment received. As far as event resolution and follow-up actions, agency will perform data collection and analysis for tracking and trending to address quality improvement internally. Now we're going to talk about Mr. Case. The reportable medical event other, acute gastroenteritis, and event intervention, hospital admission. Mr. Case is a 73-year-old male receiving choices services. Mr. Case began having episodes of abdominal pain, nausea, and vomiting. He was unable to hold down food or fluids. The actions taken, the agency worker notified the supervisor. The member's primary care physician was contacted, who gave instructions that Mr. Case should be seen in the ER. Family members transported Mr. Case to the ER. Mr. Case was admitted to the hospital for acute gastroenteritis and pancreatitis. The agency's event management coordinator completed the REF, stating this was a reportable medical event, other acute gastroenteritis, as well as a reportable event intervention, ER, and hospital admission. The REF was completed and submitted to DIDD and the MCO by close of the next business day after the occurrence or discovery. And on this one, the agency will perform data collection and analysis for tracking and trending. We're going to talk about Miss Elliott, other reportable event, medication variance and omission. Miss Elliott is a 57-year-old female enrolled in Choices and lives in a CLS home, or Community Living Support Home. Upon arriving to her shift, the CLS worker reviews Miss Elliott's medication administration record, or MAR. She notices the 8 o'clock a.m. and noon medications were not signed off as administered. Upon further investigation, Miss Elliott's medications are still in the locked cabinet and have not been administered. Actions taken. This is reported to Miss Elliott's prescribing physician and noted the risk of harm associated with missing the medication. Her prescribing physician gave instructions to observe her for any changes in status. Miss Elliott does not receive or does not experience any complications or negative consequences from missing her medications. The event management coordinator completes the reportable event form as this constitutes an other reportable event, medication variance or omission requiring observation. The EMC submits to DIDD and the MCO by close of the next business day after the occurrence or discovery of the event. The agency will perform data collection and analysis for tracking and trending, along with education to workers regarding medical administration or medication administration and documentation. One more for you. Finally, we'll be talking about Mr. Hansen. This is a reportable behavioral event with property destruction greater than $100. Mr. Hansen is a 36-year-old man enrolled in Choices and lives in a community living support home. Mr. Hansen became upset with his roommate over the TV, over which TV show they should watch. He began to yell and shove the furniture. The TV on the dresser fell to the floor and broke. The TV is valued at $750. This behavior is not on Mr. Hansen's person-centered support plan and is a new occurrence. Actions taken. The CLS worker reported the event to the EMC and completed the ref stating that this is a reportable behavior event, property destruction exceeding $100. The EMC submits the REF to DIDD and the MCO by the close of the next business day after the occurrence or discovery of the event. For the event resolution and follow-up actions, the agency will perform data collection and analysis for tracking and trending, and the agency will collaborate with the MCO's care coordinator and Mr. Hansen's providers to evaluate if any changes are needed to Mr. Hansen's person-centered support plan. And I'm going to turn it over to Skylin for the next piece.
Right. Didn't they do a good job? Those are the choices to me's. See how that all works out? Okay, so next up are the questions that we received that were pre-submitted. We emailed out to our choices providers and asked for some pre-submitted questions, and if we received those, we were able to incorporate those into the PowerPoint presentation. So we did receive a few, and so these next few slides will be us presenting those questions and our proposed answers. If we did not fully answer your question, please do put some clarifying questions into the chat so we can make sure that we do touch on those and make sure that we answer them to your expectations as well. All right, so we'll move on. So the first question is, let's see, which choices services require reportable event management training and or provider investigator? And I had no idea when I talked about this earlier that I would be, I didn't realize that I would be answering this question when I talked about those exempt providers and the ones that were not exempt. So here's a list of those providers who are exempt from some of the trainings and those providers who are not. So to make it pretty simple, the providers who only require the event management DSP only training are the home delivered meals providers, PERS, so personal emergency response system, assistive technology, minor home mods, and pest control. So the only training that is required of those providers for reportable event management is the event management for DSPs. And that is the training that is loaded onto the DIDD reportable events management website. So it's available there. Vicki, is that also available in Relias?
Sorry, had to get to the unmute. Can you ask me the question again? I was trying to work on some questions for
I'm
you.
sorry. Is that training, is the event management training for DSPs, is that also available in Relias? Or is it only on?
The reportable event forum is in Relias, and the event management training is in Relias. With the additional update that will be coming out soon, we'll offer it also through the web page.
Wonderful. Awesome.
And all copies of all the training are on the web page as well for those people that want a downloadable copy.
Wonderful. So then that leaves all of the other trainings as a responsibility for personal care, attendant care, adult daycare, in-home respite care, inpatient respite care, assistive care, community living supports, family model, critical adult care, and consumer direction. And again, if you'll notice, the question is specific for choices. So if you're on here and you are 1915C, or if you're a non-choices provider, please note that this is a question that is specific for choices. So if you don't feel that your service is listed on this list, it's because it is for choices. And you are, if you're not on the exempt list, then you are more than likely on the all included list. So please reference the list on the website. Right. I think the next question is for Leanne. Perhaps.
Yes, I'm going to pick up on our next
Woohoo!
question. This also talks about some exclusions. So will there be any other agency types looked at for exclusion from this mandatory training, like ICF providers due to low incident numbers? So the answer to that is that neither state nor private ICFs are exempt or excluded from the REM process or training expectations. And yes, they are required to have a provider investigator also. We just talked a lot about training, but another bullet on training here for REM training requirements. You can go to the training requirements chart, and here's the link, but it is on the DIDD REM website that we just talked about. All right, I think this one is mine also. So will there be an allowance or reimbursement for the greatly increased administrative cost of training for investigators? So DIDD will pay the initial enrollment fee for one person per provider to attend the training for each contracted provider in the region. You can choose who you want as your provider investigator, or you can also contract with a provider investigator. We talked about that earlier in the presentation today. Providers need to ensure that all Tier 2 investigations are conducted by a certified provider investigator. And as part of that certification, the provider investigators complete the required training through QUILTs. And again, it's required for a provider to have a staff member or a business contract with a provider investigator that has been certified. And we do think that this aligned system that is going to have some economies of scale, and it's going to allow us to provide quality service for the people we serve.
All right. The next question, we are required to have a quiet room or area by our licensure for behavior redirection, calming for agitation, or if the participants simply want to get away from the group. If we utilize the room or area which we are required to have, does this now constitute a reportable event? Answer here. Thanks so much for sharing your quiet room. It's a wonderful option to have available to those you support. And we appreciate that you have that option for persons needing time to collect their thoughts away from the community. Utilization of the quiet room should be discussed with the care coordinator and placed in the person-centered support plan. The quiet room area would not rise to a reportable event unless forcible actions are utilized. If it is more of a forcible action for the person to enter that room as a safety intervention or response to a behavior, then it would be reportable. If the person enters the room at their own volition, which is required by the HCBS settings rule, then it is not reportable since there is no restriction and it was the person's choice. The focus is prompting dignity of choice for the person supported while mitigating risk of their decisions without being forced by staff. This is detrimental both for a person supported and your staff. The next question, are we now required to report all of these incidents via a secure system, which we do not have and have no requirement to have? So although we are required to submit, we have no means of doing so. We do not transmit medical records. We receive the care plans via secure emails from the MCOs that they initiate. Answer there is that secure emails have been a requirement for all providers due to the sensitivity of protected health information and privacy of persons supported as well as your staff. It is our understanding that there are options and applications to provide a secure email element to most email platforms. If you are unable to submit a secure email, please notify your health plan provider representative and we'll be happy to assist you. The next one, do we have to treat cold, flu, pneumonia, UTIs, and interventions as reportable events? The current critical incident management process for reporting incidents should be familiar to you, as it is required for the choices providers. Similarly, the REM new process for initiative to align and streamline 3 different processes, critical incidents for choices providers, reportable events for ECF choices, and Katie Beckett, and incident management for 1915C providers. REM primarily focuses on reporting events associated with abuse, neglect, or exploitation, which is consistent with the 3 processes. One new component that differs from the current choices critical incident process is the 2-part reporting for medical behavioral events, which has raised many questions from all providers. The expectation is that our provider network tracks and trends all reportable and non-reportable events to identify best practices and interventions to decrease these types of events from occurring. For additional medical events, REM focuses on those events that are new or pose safety concerns for the person. For example, if an individual has a urinary tract infection and has not known to have a history or symptoms of behavior personality changes, this would be reportable. This is not to say that non-clinical personnel need to diagnose. They would need to report what they observe. As always, your event management coordinator would discern if this needs to be reported. For additional behavioral psychiatric events and interventions, these also may also be reportable events. We encourage providers to review the REM protocol, the REM definitions document, and subsequent REM trainings when determining if and when this type of event is reportable. These types of events were not captured in the choices critical incident process, but are deemed necessary to better serve the individuals we support with the upcoming REM process.
Right. So moving on, our ask of you. We understand that all of our providers may not be contracted with all LTSS programs, but it's important that all of our providers understand the importance and necessity of the aligned reportable event process as a whole. Please continue to hang in there with us by attending the scheduled webinars and submitting your questions via the chat box, as we are seeing a lot of questions come through, and we very much appreciate that. And then also submit your questions for the DIDD help inbox throughout the week and as you're processing all of this information as well as completing your training. So as questions come about outside of the webinars, please do feel free to submit those questions through the DIDD inbox, and we will all work together to get those answered for you. Slide. As mentioned throughout the presentation, please continue to visit the DIDD REM website for valued information pertaining to all things reportable event management. Trainings. Keep up the training momentum. Here's a list of the courses either available or upcoming. This information is also on the website. If you have questions regarding the training, please submit them to the DIDD help inbox, and we can put that in that inbox is right here on the slide, but if we need to put it in the chat, we can do that as well. Please note any training completed outside of the Relias or Quilts environments, attestation is required. So please send that via a spreadsheet to include the information listed below so that we can have that all tracked internally. DIDD keeps up with that for us, and we greatly appreciate them for doing that.
All right, I'm going to take us home. Just wanted to let everybody know that we do understand that it can be difficult and there can be challenges when adjusting to any new process. And especially with one that has as many nuances as this one, sometimes it can be difficult to see how it applies to your daily work. And we just want to continue, as Skylin and Jamie said, encourage you to ask those questions. We're here. If we don't know the answers, we will go back, research them, and talk to our collaborative partners, DIDD and TennCare, and make sure that we get you guys an answer because we all want to work together to see this process run smoothly and to promote the quality of care for all of our person supported. So thank you all just very, very much as we go through this together and move closer to the implementation date. So thank you guys. And I know I've seen lots of questions out of the corner of my eye come up over in the chat. So I've got to come back over here and see if I can get back to the beginning of these. Lauren?
Yeah, and well, if I will start scrolling if that works for you guys. Good job, ladies. You guys, it was good to break that up. It was a lot of information, but nobody got too overwhelmed and too out of breath. We had one pre-submitted. I'll get to that one first, and I'll just kind of shout them out there, and you guys can divvy them up kind of how you see accordingly. First question we had sent to us: will the abuse and neglect prevention reporting for choices course continue to be required annually for the ECF staff?
Okay, I can take that one. Okay, so the MCOs are working together along with DIDD to align our reportable event management training requirements to ensure that providers have the most up-to-date information, training, and resources. So we're hopeful that by aligning our reportable event management training requirements, this will allow our provider network to receive consistent and timely training by utilizing annual joint trainings rather than 3 separate trainings covering the same topic. So more to come on that. Regarding the annual reportable event management training requirements as we continue to build out the process requirement throughout our joint collaborations with DIDD and TennCare. So more to come.
Okay, more to come. Will this presentation be sent out?
It will be.
Okay.
It will be once our we have our communications departments. Each MCO has a separate communications department that reviews all of our outside facing communications and they have to approve it and review it. And we had expedited the request, but that takes some time. So, and since it's a joint operation, there's a little bit more time involved in that. But yeah, the presentation will be uploaded really quickly. Vicky's really good to get that uploaded within days, really. So you will have that. But as far as the PowerPoint itself, we will be sure to let everyone know when that gets uploaded, and it will be accessible through the website as soon as we get approval.
Sounds good. This slide shows choice group 1 and 2. Does it not apply to choices group 3?
We actually made a typo in that. That is going to be groups 2 and 3, not group 1. We do apologize for that, and we'll update it before it's sent out or uploaded.
Okay, I see you put that there in the chat box too. I was just trying to go through it so I wouldn't skip anything. Okay. Well, we received these slides. We got to that. Donna had a question. Does this mean that there are already trained investigators at the agencies? I think that might have been through the first set of slides that Skylin was talking about.
There are. Vicky, do you want to touch on that because of the LRA piece?
Sure. There are some providers that support both ECF choices 1915C waivers and those that are in intermediate care facilities that have already trained and certified investigators. Those investigators that are currently participating as pilot members in the Quilts Institute will be certified investigators and able to conduct those investigations as well. So with that being said, we probably have close to 50 investigators already in the field. They're able to conduct those investigations as well as those that are in the pilot.
All right, thank you, Vicki. Next question. If an incident happens outside of normal business hours, will anyone in the agency be able to call and make the initial report since it has to be reported within 4 hours? Or does it have to be the trained investigator?
And Skylin, if you're okay, I'll go ahead and take that question. So anyone can report an event to the hotline. Anyone that suspects an allegation of abuse or neglect or exploitation that meets that criteria that was discussed in the presentation of a Tier 1, which would be an egregious event that required some type of intervention or a sexual abuse allegation. If it's a Tier 2, that can be submitted through the reportable event form. So you do not have to call for the Tier 2 events. While anyone can make that phone call to the 800 number, we do prefer it to be a direct witness because that person's going to be the individual that can give us the information necessary for us to make a determination if a response investigator needs to go to the scene, and also so that we can ask those clarifying questions to determine if other entities need to become involved, such as law enforcement or adult protective services and other entities like that.
Thank you, Vicki. I know some of these questions were answered in the chat, but just in case, like Vicki there was able kind of to explain a little bit more, I'll probably go ahead and read them out. Next question. When you say classification, is that referring to class 1 and class 2?
I think that was, I saw that question pop up as the scenarios were being spoken. I think that goes to the classification. No, I'm just going to say no to that. It is not in reference to the class 1 or class 2. It is in reference to the description of the event. So when we were saying classification, it was, you know, is this an ER visit as well as, you know, for pneumonia, 911 call, everything that involves that event and has a box to check. We would like for that to be checked. And the classification was more of a description of the event. Does that
Okay.
answer that classification question? If it doesn't, ask again.
Yeah, does for me. Most of the time, the hospital doesn't release client's diagnosis. Will they be giving medical diagnosis to us now?
I don't think the implementation of this new reportable event management system is going to change the information that hospitals release. You may not know the diagnosis, but if you do know it and it's on the list, feel free to check it. If you just know that it's an inpatient admission, if you know your the person that you support is now inpatient, just check inpatient.
Thank you, Leanne. Please define agency performing data collection and analysis for tracking and trending. Is there a particular format you're expecting?
More to come. That is so funny. We were just talking about this yesterday, and we're actually working on, so if you haven't already, you will have the opportunity to have the training for the PRERT/EMC training. So the PRERT is the Provider Reportable Event Review Team training, and the EMC is the Event Management Coordinator. So that is a training that talks about the requirements for our providers to get together at least monthly and to review all reportable and non-reportable events. And the expectations of what we're looking for during those meetings. And part of that outlines or identifies the tracking and trending piece. And there are some tools and resources available for tracking and trending specific to behavioral events, but those can also kind of be a jumping point for you to utilize for tracking and trending all events, you know, however you decide. There's not a really scripted program for that. There are various trainings, and I do know that DIDD has a really good SME, so to speak, when it comes to tracking and trending, and there are various resources available. Vicki, I'm not sure if there's more you want to add on the tracking and training piece outside of there is more to come, but I wanted to offer that up for you to speak to as well.
Sure. Yes, as Skyland pointed out, that training is already identified and provides you details and some guidance in that Relias training. For those of you that do not utilize Relias, and many of the choices providers do not use Relias, that training is also posted on the REM website under training resources. So you can download that. As additional training and enhancements are made available, they will be posted, and it will also be put out through the various MCOs through their communications, as well as the DIDD open line, to let you know when we do create additional assistive guides or trainings.
Thank you, Vicki. We have a question, I think, about one of our scenarios, maybe that Jamie read off. It was about the television, and the question was, will Mr. Hanson be required to replace the TV?
And I might have to, kind of take that one down and check with our provider advocates to see, really that particular, with that scenario, who would be responsible for paying for the television itself. So what I can do is just jot that down and either respond directly or have our provider advocate reach out or provide a response to be included in the frequently asked questions when they are distributed.
Yeah, so to be continued, maybe on our next forum.
Exactly, and I believe it's really
follow-up.
based on agency policy. I don't know if there's specific guidance there, but I will certainly find out.
You stumped us. Thank you.
And I agree with what Jamie said. If anybody else has anything to add to that question, but I do believe it is based on agency policy, but to be continued. We will get that back to you.
Sounds good. Next question. What positions does REM require each choices provider to have? EMC, provider investigator?
All of the above.
All righty.
Yeah.
Adult day at times serves group 1 members. So how would we treat them under this system if group 1 is exempt?
Can you repeat that?
Sure. What positions does REM require each choices provider to have? EMC, provider investigator?
Oh, I think it was the next question.
I'm so sorry. Adult day at times serves group 1 members. So how would we treat them under this system if group 1 is exempt?
So I'm going to attempt to answer that one, and I'm going to look to my partners there that if it's incorrect to let me know, and we can follow back up. If it's a group 1 member, they would be exempt, and then you would follow the reporting guidelines for group 1. That's my initial thought of that, Vicki. Or anyone else on the call?
I can't really help you with the choices group parts. That's outside of my expertise. Sorry.
Okay.
No, and that is it would be still reported through with group 1 to the Department of Healthcare Facilities, as well as the LCSS ombudsman.
All right, I think we got that. We did have another question about the TV and the reimbursement, so that is a hot topic. So definitely follow up. We had someone ask about training if you don't have Relias, and Jason Allen, our Director of Investigations, did pop a link in there to some trainings on REM. Next question, going back to staff exploitation scenarios, would the provider be required, be required to reimburse the individual? Okay, I think that's the same TV. When will the quilt training become available?
This this is Shannon Nahus at TenCare LTSS. I can take this question. So we have sent out communication this week that we have extended the provider investigation training pilot through July 15th to all learners in the pilot. And after that pilot, we'll be taking the learning, and we'll have a date where we roll that out statewide after that. That date hasn't been determined based on the pilot and the information and changes needed. But it will be shared. We initially had shared that the target date was July 1st. It will not be July 1st since we're extending the pilot to July 15th.
Thank you, Shannon. I know you answered that too on the chat, but thank you for going back over that. We had several questions about some trainings. How do we access Relias to take the 2 tests required? Is there a link to go to? Is that somewhere we can go and get these done?
Lauren, I'd like for Tiffany to explain the process for the folks that do not use Relias and how they can get an administrator. She's our training coordinator for DIDD and your point of contact if you need assistance with accessing the training either through the web page or through Relias. So Tiffany, if you'll speak to that, please.
Sure. Hello, everyone. If you need a Relias administrator for your agency, then you can submit, 1 to 2 people to be trained as your Relias administrator. This will require a 2, maybe a little bit longer hour WebEx training to learn how to do the following. It will allow you to create profiles for staff. You'll be able to assign staff the video, the REF instructions, and the EMC course. So those are the 3 things that you would be able to assign to your staff to complete. It would also allow the administrator to deactivate a staff after the course is completed, and also to run compliance and completion reports. And that information, the information for the person that you would want to, that you are identifying to be your administrator, would need to be sent to didd.isqa@tn.gov, and they can get you set up with the training for that Relias administrator.
And Tiffany, can you also speak to when they have their own Relias, but they're not part of the DIDD Relias system? Is that also through the administrator to get those trainings downloaded to theirs, or how do they go about that? Or is that something you simply have them to contact Karen for?
That's what we've had them do, is to contact the didd.isqa@tn.gov, and they can help you with that.
Okay, can you pop that in the chat box so that they can see the?
Sure will.
Thank you.
Next question for whoever wants to speak up. When will this be implemented?
September 1st, 2021.
Thank you. How many choices providers in home care are in the pilot?
We currently have 12.
Great, thank you.
Which pilot are we talking about?
Oh, that's a great question.
They said home care. Does that answer your question?
So there's the reportable event management pilot, so the overall process, and then there's also the quilts pilot, the quilts provider investigator pilot.
Okay, Jeff Hanover, I think, submitted that. So if you, Jeff, if you're still on, if you want to pop some clarification in there, we'll try to get you the best answer we can. Next question.
Let me say on that one, on that one, I can help out, because unless they were already the pilot providers that are participating in the entire system-wide pilot of the REM had to be providers that were dual supporters through 1915 or ECF that had investigators already. that would have been labor relation alternative trained investigators. So even if they were choices only members, well, there would not be any choices only members in the system-wide pilot because choices members had not received that level of certified investigators. For the pilot of the Quilts Institute and the provider investigator training, that's the one that we have the choices providers that are participating in that pilot. So that's the reasoning behind no choices only providers participating in the system-wide piloting, but they are participating in the provider investigator.
Got it. Thank you, Vicki. Next question, why is it that caregivers are required to take the reportable event form training? Will they be completing forms or just reporting to EMC?
I mean, I can take a stab at it. So we've always asked, and this is me from, y'all know I am ECF side, right? And I'm being grandfathered in maybe to the choices side. But so from an ECF perspective, we've wanted the reportable events, those events to be reported from firsthand experience. So the expectation is that if you saw it, if you knew about it first, we would love for that information to come from you. So that means we want you to know about the form and we want you to know how to complete it because you're the one who knows all the information, right? So you saw it, you heard about it, you discovered it. Here's the form, please complete it. If that's not something that your agency feels is that's the way that you want it to work out, or you feel that that's a responsibility you don't want to put on your staff, then that's an agency decision. But it is important for your staff to understand the form that is being completed by your event management coordinator. So it's all part of the process. So as I'm a paid support, I would like to know that my words are going to look like this on this form. So it's important for your staff to understand that this is how everything is going to be translated over on this form. This is what it looks like, as well as if they come across this form in somebody's file, in somebody's chart that they're reviewing, that they know what they're looking at. So it's all part of the training. It's all part of the process. So why not involve them in it 100%? Because they're the front line, right? So they're the ones that we're relying on, number one, to keep the person healthy and safe, right? So they're the ones who also are going to provide us with all the information that we need to know what we need to do to support them and the person. So the most effective way is for them to know what they're answering to, right? So that's why we're asking for, our frontline people to know the expectations of the process and the role for the reportable event form. That's just me.
Yeah,
That was
Carlin,
my
that's
stat.
a really good point. Also, I'd like to mention, that your EMC could win the lottery, and you need to have somebody or, have an illness or be out or something. Everyone needs to have the at least ability to complete that form and know how to complete the form and what's expected from it. So just to make sure that, you kind of have across the board coverage. Because, I'll be honest, we have had certain situations where we didn't get a form because the one person in the office who could complete it had an emergency, and there's nothing you can do about it. So, it's just it's to ensure that we get the information we need timely, also to ensure that you are covered as well.
It's like a backup to the backup to the backup.
Exactly.
And I think Vicki might want to weigh in a little bit too. Vicki?
Yeah, I just want to remind everyone that every paid staff member is a mandatory reporter for any suspected abuse, neglect, and exploitation, not only to the Department of Intellectual and Developmental Disabilities through the REM system, but also Adult Protective Services or Children's Services. So you are a mandated reporter. Now, whether or not the provider has you to actually complete the reportable event form, or if the provider event management coordinator completes it on your behalf, that system is up to each provider agency to determine how they want to proceed. However, you have to know what is reportable, and the only way you're going to know what is required to be reported and the time frames that it's required to be reported in is if you complete the training. And so it's really critical that you know that, because providers are going to be held accountable for ensuring that reports of events are reported appropriately and reported timely. So it's really important that you and your staff understand what is expected for reporting, not only to DIDD, but for APS or even law enforcement.
Thank you, Vicki, and thank you everyone for weighing in on that. As a Choices HCBS agency, we report incidents to our PSSA state licensure office. Will we still need to do that?
To my knowledge, this process does not change or have anything to do with those reporting requirements. We would not change that. So whatever those are for you, this is separate.
Okay, thank you, Leanne. In the past, our event review committee meetings were held every 2 weeks. Is this being changed to now 1 time a month?
So the new requirement, or the requirement for the PRERT is to meet at least monthly. Whatever you determine as a provider is efficient to your processes is what we ask. So at least monthly, no, don't to exceed longer than monthly, but we have providers who are meeting weekly, the bi-weekly is pretty much the norm from what we've heard thus far. But yeah, no more time, not to exceed monthly, but however often you feel necessary within that month time frame.
Thank you, Skylin. We have Mahan Fritz. He's my question about Group 1 was overlooked for adult day serving Group 1 members. If you can, just add a little bit more clarification in that chat box, and we'll jump down there to it to make sure we get to the right information. Next question, and we've already registered twice for the PI training, but we keep getting emails from our provider rep saying that we haven't. Can someone contact us to make sure that's correctly done? Also, could a list be given out of the PIs already in the program that we might partner with? And they did leave an email, so we'll make sure that our folks get that. Keep scrolling. Got some conversation about the TV. The Relias training email, if you need to have someone in your agency signed up for that, that's in there. We have some conversation about the TV, but not really questions, just some people kind of weighing in on their thoughts on that and their different agencies. But I think that does it for questions, at least for now. So I don't know if we want to give it a few more moments and see if anything pops up. I don't know if any of our folks, our panelists, have anything else any kind of final thoughts. And I'm gonna, if the panelists kind of look at the question at the bottom, just if you want to read it, make sure I'm answering, I'm communicating it right. But Mahan said the answer given was a specific reportable requirement for nursing homes concerning Group 1 members. My question was about adult days serving Group 1 members. So should we treat them as Groups 2 and 3 and report those on those Group 1 members?
So the reportable event management process only applies to Choices Groups 2 and 3. So what we're saying is that if something occurs, if an incident occurs with a Group 1 member, that the REM process does not apply to that person. Whatever reporting process is initiated or you're currently trained on for Group 1 members, which I don't know, and I'm sorry, I don't know that. That's what you would be implementing during those types of events or incidents, whatever they're called for Group 1 members. So reportable event management, just the overall thing to remember is that reportable event management only applies to Choices Groups 2 and 3. We cannot speak to Group 1 as far as reportable event management goes, because that is not part of the reporting process.
And that's currently true for the critical incident process. The critical incident process with Choices is also Groups 2 and 3.
All right, thank you, Jamie. A couple more questions have popped in. So REM was designed to simplify the process. If an incident occurs, we will report to MCO, DIDD, and the state, APS, police department, and any other agencies that need to be notified. I guess
can
a
help with that.
clarification question.
Yeah, I can help with that. So that reportable event form, when you send it into DIDD, it will also be sent at the same time in the same email to the managed care organization. If you have something that you suspect is a tier 1 event, meaning that it required some form of intervention, you would call the hotline. And at that time, the on-call investigator that's triaging that call can assist you and say, hey, this does appear to be something of a criminal nature, so therefore you do need to also make a report to the local law enforcement. If it's not something of a criminal nature, they'll go ahead and take that information and respond accordingly. You have to keep in mind that Adult Protective Services and the Department of Children's Services also investigate events related to abuse, neglect, and exploitation. That has always been the case, and this is not a change in any of those processes.
Thank you, Vicki. Another question about the choices providers. Does REF replace the critical incident report?
Yes, it does. Yes, it will.
Yes, yes, yes. All right, we are all caught up on questions. So I know we've had a ton of them, and thank you guys for getting those in the chat box. Any final thoughts from any of our MCO representatives or anyone today?
Just always want to make sure and mention that we are available for you. Our contact information is, while it's also on in this particular slide deck, it is that information is on the REM website that is posted above in the chat. And so, feel free to reach out to any of us at the 3 MCOs, as well as your, provider advocate. They are here for you as well.
Thank you so much. And Vicki, just let me know there's another WebEx in 2 weeks. So we'll have this opportunity again. We know it's a complicated switch, and we're going to answer your questions as best we can. From the DIDD or the TennCare side of things, anyone want to weigh in before we say goodbye?
Sure. This is Shannon. I'll go ahead and speak up. I want to thank our MCOs for leading this presentation. We've had specific requests and have done 2 choices-specific presentations. We're also planning to do we're going to do a training coming up this summer on tracking and trending, and also on dignity and choice, and we'll be sharing that information. But if you have a specific interest, let us know, and we design these presentations based on your need. So thanks again to, of course, the IDD for hosting, and to the MCOs for leading and answering our questions today.
Yeah, that's a great point. The more feedback, the better. It lets us know where everybody's kind of at with the process and what else we need to provide folks before that switch happens. All right, well, I guess we'll say goodbye, and we hope to see you guys back in 2 weeks. If you have any further questions, and just have a great day, and thank you again. Bye.
Thank you. Bye, Lauren.